President.
Senator from Vermont.
Mr. President, let me be very clear. Our health care system is disintegrating. Today, 46 million Americans have no health insurance, and even more are underinsured with high deductibles and co-payments. At a time when 60 million people, including many with insurance, do not have access to a doctor of their own, over 18,000 Americans die every year from preventable illnesses because they do not get the medical care that they should. This is 6 times the number of people who died at the tragedy of 9/11, but this occurs every single year after year after year. In the midst of this horrendous lack of coverage, the United States spends far more per capita on health care than any other nation, and health care costs continue to soar. At $2.4 trillion and 18% of our GDP, the skyrocketing cost of health care in this country is unsustainable, both from a personal and macroeconomic perspective. At the individual level, the average American spends about $7,900 per year on health care, $7,900 per individual every year. Despite that huge outlay, a recent study found that medical problems contributed to 62% of all bankruptcies in 2007. From a business perspective, General Motors spends more on health care per automobile than on steel. More on health care than on steel, while small business owners are forced to divert hard-earned profits into health coverage for their employees rather than new business investments. And because of rising health care costs, many businesses are cutting back drastically on their level of health care coverage, or they are doing away with it entirely. Further, despite the fact that we spend almost twice as much per person on health care as any other nation, our health care outcomes lag behind many other countries. We get poor value for what we spend. According to the World Health Organization, the United States ranks 37th in terms of health system performance, and we are far behind many other countries in terms of such important indices as infant mortality, life expectancy, and preventable deaths. In other words, we are spending huge amounts of money, but what we are getting for that investment does not compare well to many other countries that spend a lot less than we do. As the health care debate heats up here in Washington, we as a nation have got to answer 2 fundamental questions. First, should all Americans be entitled to health care as a right and not a privilege, which is the way every other major country treats health care and the way we respond to such other basic needs as education, police, and fire protection? 100 or more years ago, this country decided that every young person, regardless of income, is going to get a primary and secondary education, because that is the right thing to do and good for the country. But unlike every other major industrialized nation, we have not come to that same conclusion that health care is a right. Second, if we are to provide quality health care to all, the next question is, how do we accomplish that in the most cost-effective way possible? You can provide health care to all people in a lot of ways, but some of those ways will essentially bankrupt this country. What is the most cost-effective way to provide quality health care to every man, woman, and child in this country? Now, in terms of the first question that I asked, should all Americans be entitled to health care as a right, I think that the answer to that question is pretty clear. and is, in fact, one of the reasons that Barack Obama was elected President of the United States. Most Americans do believe that all of us should have health care coverage and that nobody should be left out of the system. The real debate is how we accomplish that goal in an affordable and sustainable way. In that regard, I think the evidence is overwhelming that we must end the private insurance company domination of health care in our country and move toward a publicly funded, single-payer, Medicare for all approach. Our current private health insurance system is the most costly, wasteful, complicated, and bureaucratic in the world. Its function is not to provide quality health care for all of our people, but to make huge profits for the people who own the companies. That's what private health insurance is about. With thousands of different health benefit programs designed to maximize profits, private health insurance companies spend an incredible 30% of each health care dollar on administration and building. 30 cents of every dollar is not going to doctors, nurses, medical personnel. It is going to bureaucracy and administration. Included in that spending are not only general administration and billing, but exorbitant CEO compensation packages, advertising, lobbying, and campaign contributions. Public programs like Medicare, Medicaid, and the VA are administered for far less money. In recent years, while we have experienced an acute shortage of primary health care doctors, as well as nurses, as well as dentists and many other health care personnel, we are paying for a huge increase in health care bureaucrats and bill collectors. Over the last 3 decades, the number of administrative personnel has grown by 25 times the numbers of physicians. So instead of investing in primary health care, instead of investing in doctors, instead of addressing the nursing shortage, where our health care doctors are going is into health insurance bureaucrats who spend half their lives on the telephone telling us that we are not covered for the procedures we thought we had paid for. That is a dumb way to spend health care dollars. Further, and not surprisingly, while health care costs are soaring, so are the profits of private health insurance companies. From 2003 to 2007, the combined profits of the nation's major health insurance companies increased by 170%. Health care costs are soaring, people can't afford health insurance, and yet the profits of the private health insurance companies have gone up by 170% from 2003 to 2007. And while more and more Americans are losing their jobs and their health insurance, the top executives in the industry are receiving lavish compensation packages. It is not just William McGuire, the former head of United Health, who several years ago accumulated stock options worth an estimated $1.6 billion, or Cigna CEO Edward Hanway, who made more than $120 million in the last 5 years. It's not just them. It's the reality that CEO compensation for the top 7 health insurance companies now averages $14.2 million. 46 million Americans have no health insurance, more are underinsured, and we apparently have the money to pay exorbitant compensation packages to the heads of private health insurance companies. Moving toward a national health insurance program which provides cost-effective, universal, comprehensive, and quality health care for all will not be easy. And that is an understatement. It will not be easy. The powerful special interests, the insurance companies, the drug companies, and the medical equipment suppliers, among others, will wage an all-out fight to make sure that we maintain the current system, which enables them to make billions and billions of dollars every year in profits. In recent years, these special interests have spent hundreds of millions of dollars on lobbying, on campaign contributions and advertising. And with unlimited resources, they can make out a check as big as they need. They will continue to spend as much as they need in order to preserve this dysfunctional health care system from which they profit so much. But, Mr. President, at the end of the day, as difficult as it may be, the fight for a national health care program will prevail. Like the civil rights movement, the struggle for women's rights, and other grassroots efforts, justice in this country is often delayed, but it will not be denied. We shall overcome. Thank you, Mr. President. I yield the floor. Mr. President, I have one unanimous consent request for a committee to meet during today's session of the Senate. It has the approval of the majority and minority leaders. I ask unanimous consent that this request be agreed to and that this request be printed in the record.
Without objection.
Mr. President, I yield the floor and note the absence of a quorum.
Clerk will call the roll.